All right, the flu has been top of mind for a lot of people, especially those with kids who are susceptible.
But you may feel like you have flu-like symptoms and not really have the flu. So joining us at the table is Dr. Paul Schalch, an ear, nose, and throat specialist at Sharp being here, Doc.
Thank you for inviting me.
All right, so this is something so interesting. You and I were even talking about this in the green room. I said, I felt like I had this week where my head was congested and I'm so nervous about getting the flu. It's what we've all been talking about. So talk to me about the symptoms between the flu and what you're talking about with is something related to the weather.
Correct. With the huge weather variations that we've been experiencing, I mean, you saw it on your forecast. There's 20-degree variations from one day to the next. There's a lot of people that have a susceptibility to have what's called barometric headaches or pressure headaches, particularly if you have more or less underlying chronic sinus disease or nasal congestion. You will feel changes in that pressure, and it will be basically feeling like pressure in your head, pressure in your forehead, your temple areas, even your ears will feel clogged up, and you will feel that sort of constant need to be opening your mouth or blowing your nose. That is more a chronic condition, certainly aggravated by the changes in the weather, but it's definitely not anything that you would feel like when you have the actual flu.
So how do you know the difference between a weather-related illness and the flu, and how do you treat it? Do you treat it?
Yes, well, the flu, just to be very clear, and of course that's in everyone's mind, very high fever. You feel really sick. I mean, you really feel like you cannot go to work or do anything else. Aches in your body, in your joints, everywhere else. You feel, obviously very ill. Chronic sinus problem or a barometric headache will present with, some of the sort of flu-like symptoms you're describing, not a high fever. The pressure you will feel will be more in the chronic arena. You might have some congestion or some drainage in your nose, but you won't be having those fevers or those body aches that are so characteristic of the flu.
So it sounds like the flu could be a fever could be the big differentiator.
That would be what I would pay most attention to for sure.
So obviously if you have the flu, you go to your doctor, you get Tamiflu, or you get whatever, they're going to give you.
If it comes to that, yeah.
For the weather stuff, is there anything you could do to sort of mitigate some of your symptoms?
You can certainly take some over-the-counter anti-inflammatories, get some rest, plenty of liquids. A lot more that you can take. Most of these, even low-grade infections, are viral in origin. So jumping into antibiotics it's usually not recommended. Yeah. So certainly talking to your health professional, your primary care doc, is always a good start. But in general, getting that time to rest and taking some anti-inflammatories and then waiting a couple of days usually will take care of it.
And it's not contagious then, if it's weather-related, I would assume?
Correct. If it's weather-related, it's not necessarily infectious. It's aggravated by the weather. And even if it has somewhat of a viral origin, it won't be nearly as contagious as the flu is.
Lastly, is this something new that we're dealing with?
It's more common or more noticeable, let's say, because of the weather patterns being so different, from what we've seen before. But it's definitely not new. I mean, if you have some chronic sinus disease, that's something that we've been dealing with for, of course, many, many years.
Yeah.